Electroconvulsive therapy, ECT, continues to be a highly effective treatment for individuals with severe or treatment-resistant major depressive disorder. Given that ECT is performed under general anesthesia, the selection of anesthetic agents plays a critical role in patient safety, seizure adequacy, cognitive outcomes, and overall therapeutic efficacy. Commonly used anesthetics in ECT include methotrexate, propofol, etomidate, and ketamine, each with distinct pharmacological profiles that may influence treatment outcomes. For instance, etomidate is associated with longer seizure durations, while propofol tends to produce shorter seizures but more stable hemodynamics. Ketamine has drawn particular interest due to its intrinsic antidepressant properties, though its role in enhancing ECT outcomes remains uncertain. Several meta-analyses have attempted to compare these agents in terms of seizure quality, antidepressant response, and cognitive side effects. For example, a 2019 meta-analysis by Wang et al. Suggested that etomidate and ketamine may be associated with longer seizure durations, potentially enhancing ECT efficacy. However, other reviews, such as the one by Liu et al., 2020, concluded that while some differences exist among anesthetic agents, the overall evidence is inconsistent and limited by methodological variability. Thus, despite growing interest and emerging data, there remains no consensus on the optimal anesthetic choice for patients undergoing ECT, highlighting the need for further high-quality, controlled studies. All right, let's see another recent meta-analysis on the effectiveness of different anesthetics on seizure duration and other profiles. Here is the detail of the study. Problem statement: electroconvulsive therapy, ECT, is a well-established treatment for various psychiatric disorders. The choice of anesthetic induction agent can significantly influence the efficacy of ECT, particularly concerning seizure duration. An ideal induction agent should be short-acting and have minimal suppressive effects on seizure activity. Recent studies have suggested that etomidate may result in longer seizure durations compared to other agents like propofol, thiopental, and methotrexate. However, a comprehensive evaluation comparing etomidate to these agents was lacking. Objective: to systematically assess and compare the efficacy of etomidate against methotrexate, propofol, and thiopental in terms of electroencephalography, EEG, and motor seizure durations during ECT. Additionally, to identify and evaluate specific adverse effects associated with etomidate use. Methods: a systematic search was conducted across PubMed, Embase, and the Cochrane Registry to identify trials comparing etomidate with methotrexate, propofol, or thiopental concerning EEG and motor seizure durations in patients undergoing ECT. 17 trials were included, encompassing 704 ECT sessions with etomidate, 84 with methotrexate, 2,491 with thiopental, and 258 with propofol. Data on specific adverse effects reported in these studies were also extracted and analyzed. PubMed +2, Lippincott Journals, +2 Washington University Profiles, +2. Results: EEG seizure duration, etomidate versus methotrexate, longer by 2.23 seconds, 95% confidence interval, -3.62 to 8.01, p equals 0.456, etomidate versus propofol. Longer by 17.65 seconds, 95% confidence interval, 9.72 to 25.57, p less than 0.001. Etomidate versus thiopental. Longer by 11.81 seconds, 95% confidence interval, 4.26 to 19.35, p equals 0.003. Motor seizure duration. Etomidate versus methotrexate. Longer by 1.45 seconds, 95% confidence interval, -4.79 to 7.69, p equals 0.649. Etomidate versus propofol, longer by 11.13 seconds, 95% confidence interval, 6.64 to 15.62, p less than 0.001. Etomidate versus thiopental, longer by 3.60 seconds, 95% confidence interval, 2.15 to 5.06, p less than 0.001. Adverse effects. Myoclonus was reported in 6 trials. Painful injection was noted in 4 trials. Conclusion. Etomidate is associated with significantly longer EEG and motor seizure durations compared to propofol and thiopental, suggesting its superiority in this context. However, when compared to methotrexate, the difference in seizure duration was not statistically significant, indicating that further research is needed to establish a definitive comparison between these two agents. While etomidate demonstrates advantages in seizure duration, clinicians should also consider its associated adverse effects, such as myoclonus and injection pain, when selecting an induction agent for ECT.